Hi, I'm Dr. Joseph Wittering, and today we're going to talk about akathisia. Akathisia is probably the worst side effect that you can have from a psychiatric medication. Usually, the ones we think about um, when someone is having akathisia are antidepressant and antipsychotic medications. The word akathisia comes from Greek and it means the inability to sit still. However, it's really much more than that. So, when we describe akathisia and how it's used in modern clinical psychiatry, there has to be two components. One is intense inner restlessness leading to compelled motion, and the other one is dysphoria. So the inner restlessness, the way this usually manifests is that you'll feel like you need to move. Some people will pace kind of side to side like this constantly throughout the day. It can get to the level where people actually feel the need to walk several miles a day because they are so uncomfortable. A lot of patients will describe feelings inside their muscles. At times, they'll say they feel this writhing discomfort, this kind of turning of their muscles, which is really uncomfortable. And the way they get rid of it is by moving. And so they're kind of compelled to move to dispel some of that pain. When we see it in the hospital setting, patients are usually in their beds and they're kind of kicking their legs up and down because they're so uncomfortable. The second part of it is this dark, intense dysphoria or depression, and it's usually characterized by these obsessive, negative, ruminating thoughts. And so what you have is a lot of severe depression and anxiety mixed with this intense inner discomfort. And it's these states that can lead someone to act in a way they normally wouldn't. And sometimes this can be a suicidal behavior. And it has also been associated with aggressive or homicidal behavior as well. And so what do we usually do when someone has akathisia? One thing is we want to stop the drug that's causing it as soon as possible. If someone is aggressive or they're self-harming, we usually bring them into a hospital to make sure that they're in a safe place while their body metabolizes that drug out of their system. And usually the most effective treatment is benzodiazepine. So we use things like Ativan. Things like propranolol, they can work as well, but they don't quite nearly fix it as well as the benzodiazepines do. Typically, akathisia will resolve in about 2 to 10 days. However, sometimes it can be a more long-term problem and it'll last longer, but usually it resolves pretty quickly. So I hope that this video was helpful in describing what your doctor means when he talks about akathisia. So thanks.